Thank you so much. We welcome you to this evening to our August Forefront Speaker Series. I'm Jennifer Potter. I'm Vice President for Research with UTL San Antonio, and I'll keep saying that. We are excited to showcase a very special presentation on peak performance. You are in for a treat tonight. You take, first of all, one of the best cities in Texas, and then you take an elite sports organization, the best basketball team in the NBA, the San Antonio Spurs, and then you've got the unique combination of UTL San Antonio, and as you'll hear in a moment, also UTSA. And so with that, I want to introduce President Taylor Amy.
This is obviously a special moment in time for our city, our community, the state of Texas, our UT system. The opportunity that's in front of us to create a world-class university here in San Antonio is going to be profoundly impactful for the rest of time, and we all can't wait to get going on it. It's going to be a big lift, but it's worth doing, and I like to say it's not a 1 + 1 = 2. We are all in on 1 + 1 = 10. Today is also special. This notion about peak performance is something that I learned about when I arrived. And so we've been all in on this for about 7 or 8 years. I think Bill and R.C. Buford got together maybe 8 years ago to talk about this. And here we are today celebrating how far this collaboration has come. And the reason why I think Bill loved it was the future of medicine is really trending towards this notion of precision medicine, personalized medicine, medicine that's tied to an individual's genetic and clinical predispositions to disease states and things like that. And the fact that it's trending in that direction cannot be divorced from human behavior, human action, human mobility. And so this is at the forefront of something very powerful and big. And Bill loved that. He loved the idea of doing this with the Spurs and doing this with Southwest Research Institute and doing it with UTSA. And we're all in on this, and we can't wait for it to really blossom. I'm very grateful for the opportunity to say hi to all of you and mingle. I look forward to chatting with you, and I look forward to the event this evening and learning. So thank you for this, and thank you, Jennifer.
We talk a lot about human performance, or we do, but what's happening here in San Antonio is truly special, and you're going to find out a little bit more about that tonight as we integrate a lot of different topics around this. But without further ado, let me introduce Dr. Alderetti. He is the founding director of the Human Optimization Center at UT Health San Antonio and a critical part of a new partnership, as you heard, on human optimization in collaboration with Southwest Research Institute and UTSA and the San Antonio Spurs. He also is the father of 2 wonderful children, Caden and Jack, and has been married to Mrs. Sunny Alderetti for 19 years. So he is on faculty here at UTL San Antonio. We're going to find out why that is in a moment. I also want to introduce my colleague to the left, immediate left, Dr. Guy Nicolette, an associate professor at UT Health San Antonio, who serves as the current director of sports medicine for the San Antonio Spurs. And that's one of the neat things about the partnership you'll see is when you partner elite sports with academics, you get these beautiful cycles of learning and education that can feed back into the work that you're doing on the court, or beside the court in this case, right over there. But you're also able to teach and train and improve how we do and apply that in broader settings as well in the community. And Giannina is his wife, and their daughter, Liv. So with that, I'm going to hand it off to you guys. I'm really excited to hear why the heck you're at UT Health San Antonio, what brought you here, and what makes what's happening here so special. So Dr. Alderetti, I'll start with you.
Given the interactions that are in this community, we, clinician scientists can stay involved in combat casualty care research program, in surgical education, both military and civilian. The amazing sports interactions in this area really are grassroots. In other words, I don't think we are so arrogant of a different sports communities where people stay very silo-centric. This community is very much about intermingling and translating science and research, clinical care, and otherwise. So I saw this as an awesome opportunity. This university, in the ability to interact clinical, research, military, and civilian was just an opportunity for me that we had to stay. So when I retired, we elected. What about you, Matt?
Well, I mean, briefly, how do you say no to the Spurs and to UT Health, especially given UT Health's amazing orthopedic history, kind of these luminaries in sports medicine, to be a part of the program, the people here, and really, I think, Joe, you touched on this a little bit, to integrate prevention, to integrate translation of the things that we do in sports medicine to elite athletes and recreational athletes, and translate that to bettering the community, bettering our own approach to injury prevention and health. I just couldn't pass that up. So I'm fortunate to have been chosen. I didn't choose San Antonio. I was fortunate to be chosen.
When we talk about this performance center, this partnership that we're creating, what's the vision and why, what's the connection to the military for you with that?
The beautiful thing is that the building lagged behind to a degree from a research standpoint, and we were able to create the partnership first, which has really moved along considerably as we have adopted this idea of the form and function of human performance from the standpoint of everything from molecular biology to macro performance. And what we're finding as we interact more and more in the community around the world is that this relationship is very interesting in its ability to define human digital twinning of a biomechanical standpoint and less of a physiologic. And when we interact in the neuromuscular space, that absolutely blows people away. If we can create a culture change of injury prevention, your love, before it even begins, in a neuromuscularly resilient special operator, then I'll drop the mic and leave my job.
I think what's unique is that we have a variety of individuals and organizations in our city that have a particular interest in human performance. We may come at it from different perspectives.
Absolutely.
But the questions are similar. The applications might be different, but the lessons we learn as a part of our research are going to be utilized by an elite organization, a sports athletic organization, in the military with your applications, and also potentially for the community at large, because doesn't every human need to perform?
Absolutely. It was funny, I was telling a discussion a couple of days ago. We took a surgical team 26 hours into an interaction for a young sarcoma patient, and the whole team stayed. But it was just amazing that hour 26, I could be as fresh as hour 1. And if you can barely operate a car, you're going to put a hole in somebody's aorta, and that's a bad day. So everybody deserves to learn from this process, whether you're playing pickup basketball or you're an elite special operator or you're a Spurs athlete. We can all benefit from just one step better as a human being every day.
On a day-to-day, what does research around human performance, what does learning these lessons, how do you benefit from that and apply that as you're working with a team that has objectives over the course of their season and what they need to accomplish, and maybe someone who just cares about whether they're going to be able to play basketball?
The first thing that comes to mind is, at least for me, because as you mentioned, I love ultrasound technology, looking at soft tissues with ultrasound. Science has shown us that a tendon that looks abnormal, as an example, ultrasound, with the ultrasound machine that looks abnormal, has a 4 to 6 times greater chance of being symptomatic within the next year. And this technology, this is not some sophisticated NASA technology at this point. This is available in every sports medicine office, almost, in every sophisticated sports medicine office in the country. So shouldn't we translate that into helping them live their best life and prevent some of these things that really, even if it's only slightly preventable, shouldn't we be doing that? Shouldn't we be helping the the worker in a busy warehouse that nobody knows their load. They're busy all day long, walking up and down aisles, lifting boxes. We have the technology to kind of capture what they do and apply numbers to their load, their workload, and help them prevent injury in a warehouse. We can do that. The technology exists.
So we define human performance as what?
You know, with the term, we coined the term human optimization because I really believe that no matter who you are, it's just one step better in a different level of your optimizing your condition every day. I think this is for everybody, which is to me why this community exists.
I think for me, the point is that what we should be doing is, again, taking these lessons we learn from a specific task that are translatable to a whole range of other tasks.
Yeah.
And that to me is kind of what we're trying to achieve in performance, and optimizing that, the ability to do that task is what this is all about to me.
From a research perspective and from an application perspective, we start with a definition or some shared understanding of human performance or human optimization. We recognize that we want to have the applications be broad and generalizable. That's the data gathering. The beauty of research is all of the collection of that information and assembling it and organizing it and having it make sense and meaning.
Yes.
That allows us to apply it in the broad ways that you do, and you in the day-to-day of what you're doing. So we've talked a lot about physical performance, but that's the cycle. That's the human performance work that we intend to do here. Am I correct?
There are multiple applications of this kind of data, whether it's markerless motion capture or others. You know, for instance, we really think it's important in lots of jobs, certainly as a professional basketball player, monitoring load, workload. And again, we define that in very court-like terms. You know, how much time do they spend sprinting? How much time do they, how many sudden changes of direction? How, what really is their high-intensity load? And those get synthesized into numbers that we can then work with to help keep load where we want it. The same thing is applicable to a lot of different tasks or jobs. And so I think that's where the power of this data is that yes, it's a number to something, but that means something different in every different context.
I think the great thing about all of this interaction is that this process is both big research, but also individually fed back into the system.
So with that, we're talking a lot, and I think it makes sense intuitively to think about this as from a physical perspective. Where does the mental performance, where is mental optimization or behavioral optimization fit into this?
From a research, academic, and clinical perspective, there probably isn't something that touches every injury, every athlete, every person like the behavioral and mental approach to what we're doing.
I watched the Little League World Series for as long as I could watch it, and these very young individuals on an international television stage being asked to play in the little tears and all of that, and I just wonder.
I feel pretty strongly in early sports specialization that we're doing harm to kids by specializing in sport too early. Before age 14, there is a mountain of evidence that they aren't better athletes because of it. They're not better prepared for some of the mental stressors in life or in athletics because of it, and they're at much higher risk of injury.
We want to prevent injury, and as physicians, we do that in a mechanical standpoint, but mainly as coaches and partakers in mental health. What created or what was necessary after that was the understanding of the multiple parameters of which so much are above the neck that go into your performance and your ability to avoid injury.
I think said another way, I don't ever have to think, I rarely think about the liver or the renal system when I'm dealing with a tendinopathy, but I'm thinking about the brain.
Yep.
And when I'm dealing, when we're dealing with a fracture, we're not really worried about some of these other organ systems, but we're worried about the brain. So it's really literally connected to everything.
We have a significant tranche of funds recently from the Department of Defense, in part because of this organization. And I'm hoping you could close us out a little bit and brag a little about what the science is that you're going to be doing, both here, very close someday at the Human Performance Facility that we'll be building here, but also that's already happening at the organizations I mentioned.
The congressional need was, or the congressional asking was, here is funding. Do you have an idea of who would benefit from this and what a program would look like? And I was hell-bent on creating an Intrepid on the outside, and so I said yes. And with yourself and Mr. Kaminsky and Bob Quinn, who's the Department of Orthopedic Chairman, we were able to grab hold of a granting process that first looked at Grant 1 was keeping the gray-haired special operator in a way that they can continue to impact their community. So in an effort to understand how we keep this historical education and a career of interacting with the organization after 6 deployments, in the case of some of our colleagues, crashing multiple aircraft, it has been an interaction of being the lone operator from representing the Air Force very, very far forward with other systems. So how to keep that person that's been 10 to 14 years in their career with the combined hit of that process at the tip of their spear was massive. That was a granting process. And then we began to understand kind of our special sauce with the digital twinning approach, the ability to use different receptors to add neurocognitive, to add metabolomics or genomics to this biomechanical process, and then create left of bang in a special operations training platform that may give us the ability to do what I wish I did as a young gymnast or young operator, which is if I track myself on a daily basis, I can do this at year 21 the same way I did it at year 1. That's what I desperately want to give back to the community.
Thank you for that. I think you can see in both these individuals their commitment to their field and the mission-driven work that they do. So I just want to thank Dr. Alderetti and Dr. Nicolette for their thoughtful conversation. And thank you most importantly to all of you for taking the time to come this evening and hear a little bit about what we're doing. Keep an eye out because there's going to be a lot happening in the next couple of years. Thank you very much for coming.